A thermocouple does what? Detect temperature variations in expired air. If the pen deflection was 15 millimeters and the input voltage was 70 microvolts, what would the sensitivity be? 4.66 microvolts per millimeter. The autonomic nervous system has two systems. These divisions are known as sympathetic and parasympathetic systems. If the measurement from nasion to inion is 53 centimeters, what would the measurement be from the inion to the OZ placement? 5.3 centimeters. What is a statement that is true regarding temperature and sleep? The human body does not thermoregulate effectively in stage REM sleep. A common problem associated with high altitude during sleep is periodic breathing. In order to assess the occurrence of REM sleep during the MSLT, the nap opportunity should continue for how long after sleep onset? 15 minutes. A limb movement is defined by what? Duration of at least 0.5 seconds, amplitude at least 8 microvolts increase in EMG voltage above resting EMG, and separated by more than 5 seconds and less than 90 seconds. Which of the following is defined as the abrupt loss of muscle tone associated with strong emotions and exercise? Cataplexy. Which of the following sleep stages has an increase in sympathetic and vagal nerve activity? REM. Patients with delayed sleep phase syndrome may complain of difficulty awakening, morning sleepiness, sluggishness, and difficulty falling asleep. Bright light therapy may improve which of the following sleep disorders? Seasonal affective disorder. CPAP works by providing a pneumatic splint to keep the airway open. The suprachiasmatic nucleus has the primary responsibility of circadian timing. If the right EOG electrode was placed 1 centimeter above the right outer canthus of the eye in reference to M1 and the patient looked to the right, what deflection would be seen in the ROC recording channel? Downward deflection. What is a combination of electrical components designed to increase power, voltage, or current of a signal? Amplifier. In a 42-year-old patient, you notice brief bilateral body jerks during the transition from wake to stage 1 sleep. These body jerks are best described as hypnic jerks. What EKG pattern is characterized by a no correlation of the P wave and QRS complex? Third degree heart block. Pulse oximeters use what type of light to measure blood oxygen saturation? Red and infrared light. Which of the following has the most positive impact on alertness in the shift worker? Adequate and scheduled breaks. Barbiturates affect sleep architecture by increasing total sleep time, decreasing wake after sleep onset, and reducing REM. In EKG tracing with dropped QRS complexes and the PR intervals progressively increasing until the QRS is skipped, occurring in a repeating pattern, defines which of the following? Wenckebach phenomenon. On the sleep questionnaire, the patient reports having 10 cups of caffeinated coffee daily. What would be reflected on the sleep parameters? Increase in wake after sleep onset, decrease in REM, and decrease in delta in the first half of the night. Patients with Alzheimer's disease are more likely to exhibit nocturnal agitation and sundowning. At what age can the first sleep spindles be seen? About 4 to 6 weeks of age. Time constant can be best defined as the time in seconds it takes for a waveform to drop to 30% of its calculated amplitude. At high altitude, the most common subjective sleep complaint is insomnia. Sinus arrhythmia tends to be seen more in infants and children. Which of the following would most accurately represent examples of Zeitgebers? Light and darkness. Nocturnal paroxysmal dystonia is categorized as a parasomnia. Giardiocapitis is another name for what? Head banging. In the presence of atrial fibrillation, the technician should contact medical director if sustained or previously undocumented. Oximetry uses light absorption to approximate the amount of which of the following is present in the blood? Oxyhemoglobin. The fall time constant is the measurement of time it takes the tracing to fall to what percentage of the original voltage? 37%. Central apnea is best defined by what sensor? The respiratory effort belts. The patient has a normal sinus rhythm and a normal PR interval. Suddenly, the QRS is absent following a P wave. This pattern indicates which of the following rhythms? Second degree heart block type 2. Which of the following would you not expect to see in a clinically depressed patient? Increased REM latency. The number of intervals in a period of time defines which of the following? Sampling rate. In a 30-second epoch, sleep spindles occur at the 8th and 17th seconds. The preceding and succeeding epochs were REM. This epoch is scored as REM. Define the narcoleptic tetrad. It includes cataplexy, sleep paralysis, and hypnagogic hallucinations. Klein-Levin syndrome affects mostly male adolescents. By 6 months of age, how many stages of NREM sleep are present? 3. The P wave on electrocardiogram represents what action? Atrial depolarization. The electrode located 10% up from the left preocular point and in line with CZ is which electrode? T3. Which electrode position is located 30% above the inion? PZ. During a sleep study, rhythmic EMG artifact in the EEG with associated chin EMG bursts is noted. These episodes meet the definition of paroxysm. During the first REM period, significant eye movements are noted along with the lack of atonia in the chin EMG, and the patient is yelling and waving his arms. This activity meets criteria for what sleep disorder? REM behavior disorder. What are the signals obtained by comparing voltages from two exploring electrodes? Bipolar derivation. Which of the following is the most dangerous rhythm? Ventricular fibrillation. The input voltage is 500 microvolts and the sensitivity is 150 microvolts a millimeter. The pendiflection would be 3.33. The most effective non-invasive treatment of severe obstructive sleep apnea is continuous positive airway pressure. The presence of a trace alternate pattern in the tracing of a 2-week-old term infant with eyes closed would indicate which of the following? Quiet sleep. The measurement from T3 to T4 is 43.5 centimeters. What would the distance be between CZ and C3? 10.87. Which of the following is commonly deficient in patients with restless leg syndrome? Iron. This recording artifact is characterized by producing sharp, high-amplitude waves causing signal channel blocking. Electrode popping. What are the relatively low amplitude waves with a notched appearance which appear in stage REM sleep? Sawtooth waves. Patients with advanced sleep phase syndrome may complain of early evening sleepiness and early morning awakening. In the normal cardiac cycle, the P wave occurs just before the QRS. Which of the following most closely defines capnography? The measurement of expired air for carbon dioxide content. What physiological parameters will be most affected by a 60 Hz notch filter? EMG. Vertex sharp waves are detected in what stage of sleep? Stage 1. What is the most significant problem associated with administering oxygen to a COPD patient? Too much oxygen could cause the hypoxic drive to diminish or end. What general area of the brain are alpha frequencies seen in the EEG? Occipital. In atrial flutter, the atrial rate is usually between 300 to 450 beats per minute. What would the input voltage be in microvolts if you had a pen deflection or amplitude of 17 millimeters and a sensitivity of 5 microvolts per millimeter? 85 microvolts. Gastroesophageal reflux can be monitored during polysomnography by which of the following? pH probes. A patient complains of insomnia that lasts 1 to several nights and is most often caused by traveling across multiple time zones. This type of insomnia is due to which of the following? Environmental factors. Which of the following is most attenuated by a low-pass filter of 15 Hz? 30 Hz, low-frequency filter. Sensitivity can be defined as the ratio of input voltage and output amplitude. The QRS complex of the EKG represents the electrical equivalent of ventricular depolarization. The frequency of EEG waveforms are measured in Hertz. A MSLT NAP trial is terminated after which of the following? After 40 epochs of recording time from lights out with no sleep. Sleep onset central apneas are best described by which of the following? Observed as normal events. During the sleep study, an EEG pattern with a frequency of less than 2 Hz is observed for 25 seconds of the epoch. Which of the following best describes the waveform? Delta. During which stage of sleep is muscle tone most suppressed? Stage REM. Actigraphy is used to monitor which of the following? Gross body movement. The T wave represents ventricular repolarization. What is the minimum amount of time of continuous sleep required to score a second arousal? 10 seconds.